North Vancouver Seymour.
Thank you very much, Chair. And thank you very much to my colleagues for allowing me to come in and ask a few questions. Before I get on to the crux of my questions, I just want to remind the Minister that I had asked a question last week with regards to whether or not Argyle Secondary expansion that the school district had requested was being considered. I understand that probably the minister was going to get back to me, but I just wanted to have a reminder because I assume that you don't have the capital people here with you. So I'll be looking forward to that answer later, but that's just a reminder. My question today for the minister is, does the minister have any plans to address mental health support in public schools?
Thank you, Chair, and thank you to the member for a question. Let me begin with Argyle Secondary. I know that's an important school in her district. The North Van District submitted a 5-year capital plan on June 30th, so a few months ago, as they do annually. And the number 2 district priority for capital programs, capital projects rather, was indeed the expansion of Argyle. I believe the scope of that expansion project is enough additional capacity to handle 200 students at that school. And as I mentioned last week, and I'm afraid I can't provide any further update on our end, but we are reviewing that request from the district, their number 2 priority, as I've mentioned, as part of our 10-year capital plan cycle right now. And mental health. The member asked, and I'm sure she has follow-up questions, so we'll get into a discussion here as she would like to have it. But she asked about supports for mental health in our schools. And I want to make it clear that in my mandate letter, there are a number of references to where we must do better in the school system. I take very seriously the need to have more comprehensive mental health supports in our school system, both preventative and also to offer counseling services for students that need to be in contact with mental health professionals. We have committed to ensure that students are able to access specially trained adolescent mental health professionals within the school system. We have endeavored and made a commitment that mental health counselors be available where schools identify the need so that children can get the help they need when they need it. And we have already created a specific ministry responsible for mental health and addictions. We're working very closely with them. We have a cabinet committee on exactly that, mental health. She will know, the member opposite, that the representative for children and youth most recently issued a further report. In this case, it was on a tragic case of a person named for the purposes of the report, Joshua. It came with a recommendation that asked the Ministry of Education to, within 1 year of that report, and I believe it was tabled about 2 weeks ago, to create a comprehensive mental health strategy and programs in our school system. So we've had very good discussions with that independent office to look at the supports that exist, where there are gaps. There were, of course, in that report some commendations for the school system where that individual, prior to the tragic end of their life, had received excellent interventions, and where, as an adult aging out of care, where that person was let down in the system. So I think that report is instructive as to where we can make much stronger, better efforts on providing better mental health supports in our schools, and also where the system has performed well for individuals like Joshua and others who have very acute mental health needs in our students in our school system.
Member.
Thank you, Chair. The minister just listed out his mandate letter. I think that's where that list came from. I've got the mandate letter for the Minister of Education in front of me, and I don't see any of those things in there. And that was going to be one of my questions, is why wasn't mental health supports in the Minister of Education mandate letter? So if the minister or the minister's staff could provide me with that information and where that was, that would be very helpful. My other question was, is the minister familiar, and if he is familiar, has he read the Select Standing Committee for Children and Youth special report on mental health?
Thank you very much, Chair, and let me just respond to the member. There's quite a lot in her question there, and I'll do that as best as I can. I think I may have confused her by citing things from my mandate letter and the Minister of Health Minister for Mental Health and Addictions. And her mandate letter, I know she's canvassed in her estimates already with that minister, and there were some questions about how that will integrate with the K-12 education system. So I'm very pleased that the minister in that debate was able to reiterate her commitment to working with our ministry on early prevention and youth mental health services coordination. We have a cabinet working group, as I mentioned, that is working on that right now. What we're doing as well is, as part of that strategy, is looking at the new significant resources we have coming into our school system. The member will know that with about 1,500 total public schools throughout the province, the fact that we're hiring this year 1,100 new non-enrolling teachers, many of whom are teacher counselors, many who have specialist designations who will work with special needs learners that may be experiencing low incidence problems like anxiety and other things, allows us to dramatically expand our capacity around mental health prevention, education, as well as interventions. And she asked if I had the opportunity to read the January 2016 report that I believe she may have had a role in working on. The answer is yes. The aspects of that report that are most instructive to our ministry is around the recommendations to foster more school connectedness between kids, and to also urge government to do better and have much faster assessments, do diagnoses, for example, where there may be indications by a teacher or from a parent or even somebody from another ministry. And those are all things that we take very seriously. That's part of the consideration now, and also the conversations we're having with the representative for children and youth to have a much more comprehensive and responsive mental health service system in our public education system than we have had for the last decade and a half. We realize that there are a number of gaps, but again, the good news message is with 1,100 new non-enrolling teachers, many whom have familiarity and experience and will be hired to be teacher counselors. There's never been an opportunity like this, at least in the last decade and a half, to be able to have a much more ambitious, comprehensive mental health system, services, I should say, for students in our school system.
Member.
Thank you, Chair. So just to clarify, so the new significant resources that you've just mentioned, is that new since the February budget, or is that new since, I know that the February budget had more to accommodate for the Supreme Court ruling, but is what you're saying new on top of that?
Minister of Education.
Thank you, Chair. What is net new from the February budget and the budget update that we're debating now is $177 million of additional funding this year, $681 million over the next 3 fiscal years. So that's new funding that was not in place in the February budget. It covers all of the obligations around restored language, but also includes fully funded enrollment growth and a few other items.
Member for North Vancouver Lawns, Seymour. Thank you.
Thank you very much, Chair. Can the minister tell me what resources of that new money, $177 million, is going to be dedicated to child and youth mental health services in schools?
Minister.
Thank you, Chair. I can't give the member an exact number. What I mentioned earlier is that we have a whole bunch of new tools and resources, if you like, including 1,100 new non-enrolling teachers, some of whom will be part of mental health services or a mental health model in our school system that has to be developed because we didn't inherit having one. will add on to what is there. There's some school districts and schools that do very well. There are some schools that have partnerships with MCFD, for example, and many, many others that do not. So what I can say is that there are many millions, tens of millions of dollars associated with supports to hire those 1,100 new non-enrolling teachers. A significant portion of them would be involved in the kinds of things that we may hook into a mental health strategy in the school system.
Member.
Thank you, Chair. So yes, I'm very aware of the partnerships with other ministries, MCFD and Health being two, which leads me to one of my questions. Is the minister familiar with North Vancouver's Mountainside Secondary School?
Minister.
Well, thank you, Chair. To the member, I am familiar with Mountainside Secondary, not to the degree of which I'm familiar with other schools, but I know that the ministry's worked very closely with the North Van District around this school. I'm also informed that there's a proposal into our ministry right now that will be fed into the process that we're doing around more substantive mental health supports across the province. What I do know about Mountainside is its familiarity with, or its partnership, I should say, its common modeling with John Barsby Secondary up in Nanaimo, which is a great program. It's a wellness center right inside the school. You have GPs, nurses, a partnership with Vancouver Island Health, and Children and Families Ministry as well. Belmont Secondary is another great example of a school that has excellent mental health supports within the precinct of that building. Again, you have youth and mental health counselors, youth mental health counselors, I should say. I believe the Pediatric Society is a partner that is involved at Belmont Secondary. So that's another example here on the South Island. I guess we have enough sort of examples of excellence, the school in the members district being one of them, that is instructive. We're lucky to have it because we know what better supports looks like. We know what better student outcomes look like because of a mental health prevention and mental health resources model looks like. And what I can say is that Mountainside is a great example, and it's one that's being studied by the new government.
Member.
Thank you, Chair, and thank you to the Minister for your support of Mountainside Alternative School. I know that that I had requested the people involved with the original proposal to update it so that if there was any additional avenues that they wanted to add into the original proposal, that would be updated for the ministry. And I'm assuming that you either have it or you will be getting it shortly. But just to remind the minister and the minister's staff that, yes, it is an excellent example of the partnership between Vancouver Coastal Health, MCFD, and the school system. And their proposal was, in actual fact, to get a staff member to be able to liaison between the work that the school district, in other words, not just Mountainside Secondary, but the school district, would have with regards to communication with the new foundry, because the new foundry services are also in Lower Lonsdale. So I'm going to be following that up. I just wanted to ask whether or not the minister was familiar with it, and you are. So that's good news, and hopefully either the school district will or has already submitted an updated proposal for what they were asking. My other question is then with regards to the New Brunswick model, and we all are familiar with our new representative for children and youth, who is actually from New Brunswick, and certainly a lot of his work has, and particularly this new report that was already mentioned. One of the things that I know for a fact that the new representative is extremely supportive of is the so-called one child, one file model. which he put forward in one of the recommendations that his report has, and certainly he supported the Select Standing Committee's report recommendations on that model. And I'm just wondering whether or not, A, the minister is familiar with that model, and whether or not he would be willing to work with other ministries involved with the Ministry of Education in improving communication on that one child with other ministries, because this has been an ongoing problem for decades.
Minister.
Thank you, Chair, and thank you again to the member for the question. She asked about ideas around improving communication for the well-being of kids who have mental health challenges in their lives. And what I can say is that one of the barriers that we continue to work on, I suspect she worked on as well previously, are around privacy concerns primarily. So the issue remains one of how do we, as seamlessly as possible, allow emergency room doctors communicate with counselors, communicate with police officers if they're part of the equation, communicate with school-based counselors, all of those sorts of things. The short answer really is that we've reached out to New Brunswick because we are interested in what she called the one-child model. We see advantages there that could potentially be life-saving, but also efficient and also fair to the student. Instead of having to explain their entire life story to one agency after another in pursuit of services from a series of different agencies, this would allow them to be to avoid that. She's probably aware that the mental health collaborative in BC, which was spearheaded by the Doctors of BC, has started some of the documentation around what information sharing could look like, and even in fact some changes now on what information sharing is for the group of students that we're talking about. The erase strategy that we have in schools also informs that. So I think that's probably as complete an answer as I can give the member right now. We will be leaning heavily on New Brunswick. As she mentioned, we're fortunate to have a representative for children and youth who has experience there in politics and government, who worked with a jurisdiction that seems to have done a number of very good things on this challenge that we face here in BC as well. And we have had a number of meetings with him and his staff. And we're also reaching out to people who work within the school and mental health system in New Brunswick, just to run some ideas by them and to also learn from some of the initiatives they've taken there.
Member.
Thank you, Chair. And yes, that's very inspiring to hear that you are the minister and the ministry is reaching out to the New Brunswick folks. Certainly, as I chaired the Select Standing Committee for Children and Youth, and we went through that 2-year project, that was one of the models that really came out at the top. And we are quite fortunate to be able to have the representative from New Brunswick who's very familiar with that, that program. But I guess one follow-up question to that would be, then would the minister and would your government be willing to change the Privacy Act laws through legislation to accommodate that communication?
Minister.
Thank you, Chair. And thank you again to the member for the question, which was about changes to the Privacy Act that may or may not be contemplated. What I can say is that all the ministries are working together at reducing the number of barriers that she's well aware of that stand in the way of having better coordinated, better mental health services for children and youth. I can't speak specifically about what the implications may be for the Privacy Act. It is a good question. It may or may not be necessary, so I don't have an answer for her. It's also, that piece of legislation would be more properly addressed in the estimates for the Minister of Citizen Services.
Member.
Thank you very much, Chair. At the beginning of the remarks, in answer to one of my questions, the minister talked about the new significant resources with teacher counselors and special needs teachers, et cetera. recognizing that teachers obviously can't do it all and can't be it all in schools, I'm wondering if the ministry is going to accept more non-teacher professionals in school to assist children with their mental health. In other words, people that are not members of the BC.
Minister.
Thank you, Chair. What I would say to the member is that, of course, she will understand that the primary responsibility of the school system is educating our kids who come into the school system. Kids arrive in all different kinds of abilities to learn, all kinds of different things going on in the backgrounds of their lives. And therefore, we've seen the school system evolve to have the mental health supports we have today and some of the ones that we may contemplate in the future. So in terms of the role of non-teaching professionals in our school system, we already have a considerable amount of presence in the school system. It has not been an issue with professional teachers. We have doctors, we have nurses in the school system, social workers, they're community health workers. And I think that as we move towards an even more integrated model along the lines of that the member has raised this afternoon, we'll likely see more streamlining of services, more integration of services that is going to help the child do well in school. That's why we're interested in it. It's about boosting student outcomes. It's about looking at kids who are having trouble getting through the school system right now and making sure that the school system doesn't fail them. So these additional efforts require us to bring other professionals into contact with the school system, requires us to build, as the RCY representative said, more interconnectedness in our school system. So I think she raises some good points this afternoon, and that's likely to be a feature of a more robust system of mental health services for kids in our school system.
Member.
Chair, so just to make sure I have this straight, so the ministry is considering incorporating more non-teaching professionals in the school, and would any of those non-teaching professionals in the school be encompassed in the Supreme Court agreement that was signed several months ago?
Minister.
Thank you, Chair. I think I've understood the member's question and certainly hope I have in my answer here. The MOA is about restoring class size and class composition language that was stripped out, taken out through legislation that was then overturned by the Supreme Court and deemed unconstitutional. So that is about specific requirements to go back to language that was previously freely bargained, and that obligates and triggers the hiring of the thousands of teachers that we're talking about, including the non-enrolling teachers. Within the memorandum of agreement, there is a provision around overhead that's additional to the enrolling and non-enrolling teachers. One of those agreements is in the members area in North Vancouver that will trigger and include additional hirings of education assistants, as they were then called. So she may be going there in her question, I'm not quite sure. But I think what we're talking about in her question prior is something different, not the MOA versus additional professionals that may be in the school system. We're talking about, I think the MOA is quite separate and apart from the kinds of wraparound services that we might pursue in our school system that's in connection with a mental health strategy that would bring essentially non-teaching professionals into contact with kids in our school system. I hope I haven't misinterpreted the question, but I'll let her see if she has any clarification.
Member.
Thank you, Chair. And thank you to the Minister for your answer. Yes, I was really getting at, for instance, would part of the extra money after the February budget that you had mentioned, the Minister had mentioned, 177 million, be included in hiring more child psychologists, for instance?
Minister.
Thank you, Chair. To the member, in addition to the MOA and in addition to the 177 million in new funding this year, there's a $5 billion allocation to school districts, which is for districts to meet the needs of their students. So districts have taken those resources and implemented to considerable degrees mental health supports in their school system. The member has provided a great example in her own area. Mountainside would be one of them. There's a lot of interest in better mental health supports in our school system. That's been a long-standing concern going back a number of years, and one of the things that I'm pleased I can share with the member today is that we announced the parameters and timeline of our education funding review this morning to all of our co-governance partners in the school district sector earlier this morning. And one of the things that I outlined in particular that is within the scope of the review, in addition to enhancements around special education or a review of what programs currently exist, rural funding protections, remote schools, inner city, and fast-growing suburban districts, and all of those well-known challenges, is around the gaps that we've seen over the last decade and a half on some of the mental health services that we may want to improve in British Columbia. So that is scoped into the review that we're going to have. It's a comprehensive review. It will go to the first phase of that review will be around describing and outlining and defining the principles of the review with our school trustee partners. So that will be a joint document of the Ministry of Education and the BC School Trustees Association. And I think that the member will be pleased to hear that there's a lot of anticipation and enthusiasm that mental health and what a more robust, stronger system of supports will look like, how that may be added or enhanced within the current amount of funding and under a potentially new model of funding in the BC school system.
Member.
Thank you very much, Chair, and thank you to the Minister. This will be my last question then. So the staff that will be fulfilling all of these extra roles for the robust, newer system, then to confirm, they will not all have to be BCTF members.
Minister.
Thank you, Chair. What I'll say to the member here is that, and I think she knows this, but those delivering mental health supports today in our school system include teachers, includes non-teachers. That is going to continue. That's as it has been. What I think will be different in years ahead, and I think the funding review again will tremendously benefit all of those in the K-12 education sector put their minds to this, is what a more well-integrated model looks like, where we have other ministries that are involved with children and youth in the mental health systems or provide supports today for families, what it would look like to have them more integrated into the school system. We have some great examples. We've canvassed them this afternoon where that is already occurring. We also have a huge part of the school system where that doesn't occur, or doesn't occur to the extent that it could. So that's how I think I would leave that question with the member. I think she can continue. She can expect that the good features of the system to continue, where we have teachers and non-teachers involved in delivering mental health services to kids to continue, and where we'll have additional integration with other ministries to make services better.